Okay, let's move on to testing. So John is asking if there's a timeline that the hospital hopes to meet in testing for COVID.
Yeah, I don't think we've actually set any timeline. Um, it's a good question. I struggle to answer it because I think as long as we continue to observe people with the symptoms, and the symptoms have changed extensively over the beginning. You know, before it was just you had a cough, a fever, a runny nose, or a lower respiratory problem, difficulty breathing. That's expanded now to a sudden loss of taste or smell, fatigue, gastrointestinal issues, blue toes. So there's a lot of different symptoms that are being exhibited. And so we will probably continue to test as long as we see those symptoms. You know, a lot of folks, including me, had hoped that with the arrival of the warm temperatures and everything that it pretty much, fall off like the flu does. We don't see flu patients this time of year, and we don't test. If somebody comes in with a respiratory ailment that looks maybe like the flu in May or June or July, we don't test them for the flu. So for the flu, we actually have a date where we do stop testing. But this virus doesn't seem to be behaving that way. So we're going to continue to test, particularly a patient that needs to be hospitalized. So anybody that's going to be hospitalized that comes through the emergency department or some other avenue into the hospital, we need to test them because that helps us determine where we place them. Because again, we want to cohort any COVID positive or suspected positive. We want to put them on that 2 South unit, or so that we can protect other patients, protect our staff. Our staff know that this person is positive. So that's why it's important that we continue to test. We also started back up very, very slowly, deliberately, doing non-emergent elective surgeries, endoscopic procedures. We opened up our sleep disorder center, pulmonary rehab, cardiac rehab. Normally we don't test patients that are asymptomatic. We only test people that are exhibiting symptoms. But with respect to these new surgical patients, endoscopy patients, we are now testing every single one of them, whether they're symptomatic or asymptomatic. And so again, that's to understand what are the risks of this patient that we're, if you're having surgery, you're likely going to be intubated, you're going to be put under general anesthesia. That aerosolizes the virus, and so that creates a lot greater risk. So, and there's a lot of COVID positive folks out there that are purely, they're asymptomatic, but they still have the virus and they're still contagious. So because of just the added risk in doing those types of invasive procedures, we will continue to test all of them. So long answer to a question is like, there is no date yet.